HIV/AIDS. Every day, nearly 4,000 people are diagnosed with HIV. This virus attacks the immune system, slowly stripping away the body's natural defenses. Without treatment, even a simple cold could turn deadly. Since the 1980s, HIV has claimed millions of lives worldwide. Today, antiretroviral therapy helps patients live longer, healthier lives, but it isn't a cure. The virus hides in the body, ready to rebound if medication stops. Researchers have been working on vaccines and potential cures, but none have succeeded yet. The reality? HIV remains one of the deadliest viruses on Earth, silently spreading in communities where access to treatment is still limited. For now, the best defense is prevention and lifelong treatment. Alzheimer. Imagine slowly forgetting the faces of the people you love. That's the cruel reality of Alzheimer's disease. It's a brain disorder that destroys memory, thinking, and eventually, even the ability to perform simple tasks. More than 55 million people worldwide live with dementia, and Alzheimer's is the most common form. Current treatments can slow symptoms, but they can't stop the disease. Scientists still don't fully understand why it happens, though abnormal proteins in the brain are a major clue. Families often face heartbreaking decisions as their loved ones slip further away. Until a cure is found, Alzheimer's remains one of the most feared and devastating diseases of our time. Parkinson. Picture your hands shaking when you try to drink a glass of water. That's what life with Parkinson's disease can look like. This progressive disorder attacks the nervous system, making movement difficult and unpredictable. It affects over 10 million people worldwide, including famous figures like Michael J. Fox. Medications and deep brain stimulation can help control symptoms, but they don't cure the disease. Over time, tremors, stiffness, and loss of balance worsen. Researchers believe a lack of dopamine in the brain is the main culprit. Still, despite decades of study, there's no cure. Parkinson's continues to rob people of independence and mobility one day at a time. ALS. Known as Lou Gehrig's disease, ALS is a cruel thief of strength and movement. It destroys the nerve cells that control muscles, eventually leading to total paralysis. Patients can think, feel, and understand, but their bodies stop responding. Most people with ALS die within 3 to 5 years of diagnosis, often from breathing failure. There's no cure, only treatments that slightly slow progression. The Ice Bucket Challenge raised millions for ALS research, but a breakthrough remains elusive. It's a devastating reminder that some of the most advanced parts of the human body, our nerves, are still beyond the reach of modern medicine. Type 1 diabetes. Imagine needing to check your blood sugar and inject insulin every single day just to stay alive. That's the reality for millions living with type 1 diabetes. Unlike type 2, which is often linked to lifestyle, type 1 is an autoimmune condition. The body's immune system destroys the insulin-producing cells in the pancreas, leaving patients dependent on insulin for life. Even with careful management, complications like blindness, kidney failure, and heart disease are common. Scientists have explored everything from pancreas transplants to artificial insulin pumps, but there's still no cure. For now, patients fight a daily battle just to keep their blood sugar balanced, a battle they can never truly win. Cystic fibrosis. For children born with cystic fibrosis, every breath can be a struggle. This genetic disease causes thick, sticky mucus to build up in the lungs and digestive system. It leads to chronic infections, malnutrition, and often an early death. In the past, many children with CF didn't survive past childhood. Thanks to new therapies, many now live into adulthood, but they still face lifelong treatment. Daily chest physiotherapy, dozens of pills, and constant hospital visits are common. While promising new drugs improve quality of life, there's no cure yet. Cystic fibrosis remains a heavy burden for patients and their families, turning simple things, like playing outside, into major challenges. MS. One morning you wake up and your legs feel numb. Weeks later, your vision starts to blur. That's how multiple sclerosis often begins. MS is an autoimmune disorder where the body attacks the protective covering of nerve fibers, disrupting communication between the brain and body. Symptoms vary from fatigue and muscle weakness to difficulty speaking or walking. Treatments can slow the disease, but there's no cure. Over time, many patients lose their mobility completely. The unpredictability of MS is what makes it so terrifying. Today you can walk, tomorrow you might not. Scientists still don't know exactly what causes it, leaving millions of patients without answers. Huntington. Imagine knowing you carry a gene that will one day destroy your brain, and there's nothing you can do to stop it. That's Huntington's disease. It's a rare, inherited disorder that usually appears in middle age. The symptoms? Uncontrolled movements, severe mood swings, and gradual loss of thinking ability. Over time, patients lose independence entirely, requiring full-time care. Children of a parent with Huntington's have a 50% chance of inheriting the gene, making it a devastating family legacy. There's no cure, and treatments only manage symptoms temporarily. For families affected, every day is a countdown to a disease they know is coming. Prion. Some diseases are rare but terrifying. Prion diseases like Creutzfeldt-Jakob disease attack the brain in ways scientists still don't fully understand. Unlike bacteria or viruses, prion are misfolded proteins that trigger a deadly chain reaction in the brain. The result? Rapid mental decline, memory loss, and loss of motor control. Most patients die within a year of symptoms starting. There are no treatments, no cures, and no way to stop the progression once it begins. Prion diseases are rare, but their speed and fatality rate make them some of the most horrifying conditions known to medicine. Cancer. While many cancers are treatable if caught early, some remain almost unbeatable. Pancreatic cancer is one of the deadliest. It's usually diagnosed late, when the disease has already spread. Symptoms are subtle: weight loss, fatigue, mild stomach pain, until it's too late. Even with surgery and chemotherapy, the 5-year survival rate is shockingly low. Pancreatic cancer kills silently and quickly, leaving little time for treatment. Despite decades of research and billions spent, a cure remains out of reach. For now, it stands as one of the most feared and lethal cancers in the world.